Go ahead.
All right. Hi, good morning, everyone. My name is Dr. Christian Halverson. I'm one of the dermatologists here at Maryland Dermatology Laser Skin and Vein. Today we're going to be talking about Botox treatments and other neuromodulator treatments specifically for men. For those who may not know, medicines like Botox, Dysport, and Xeomin, they're used to help to relax muscles of the face that are overactive. And when these muscles are relaxed, they help to smoothen the skin and they help to make wrinkles less noticeable. And it's pretty well known that Botox works great for women, but a lot of people don't realize that actually it works great for men too. Men can get all the same benefits from Botox treatments, and more men are pursuing these treatments. So we wanted to do this video just to describe how this works, show how it's done in a man, and some of the special considerations when you're treating a man with Botox. Botox can also be used not just for facial wrinkles, but actually also for excessive sweating. So people who sweat too much in their underarms, their hands, their feet, or even their face. Botox and Dysport and Xeomin work great to help to make that sweating less, and it can really change people's lives. So that's another area where men really can benefit from Botox. But today we'll mostly be using it for facial wrinkles. This is our patient here. He's a young guy in his late 20s. We're going to be using some Botox to help treat these forehead creases and these glabellar lines here. Basically, the reason that these lines form is there's muscles that are overactive, and every time those muscles contract, they help to reinforce some of these creases here and some of these creases here. Specifically, this area right here is called the glabellar complex. It's made up mostly of two muscles called the corrugator supercilii as well as procerus. And every time these muscles contract, they pull the eyebrows inward and down. And over time, as our skin starts to thin and as these muscles become overactive, these lines become almost semi-permanent. And so with the Botox, we'll inject it into this muscle. It will help to relax it, and those lines will become less noticeable. And then similarly, these forehead creases here, they're formed from a muscle called frontalis. And every time that we lift our eyebrows, that muscle contracts. And again, as the skin gets thinner with age, and as that muscle becomes more overactive, it can create those creases that they start to become more noticeable even at rest. And so males and females like to get this treatment to make those lines less noticeable and really just make everything look better. That's what we'll be working with today. We'll go ahead and get started with our treatment. What we've already done is we've cleansed the face with some alcohol, and now we'll start to pre-ice. So we'll put some ice in this glabellar area here, and this helps to make the treatment very comfortable, and it also helps to limit any potential for bruising. And so I'm going to get started here. Go ahead and turn towards me, and then I want you to make that frown. And then relax. We've got a little pinch, 1, 2, 3. Go ahead and frown again. Relax. Frown again. Relax. Frown again. Relax. One more frown. Relax. So we're putting the Botox directly into this muscle. Let's go ahead and get some ice over here. We're also going to put a little bit right over the outside of the brow. We want to try to maintain a nice horizontal male positioning of this brow. If we didn't put some over here, we might get a little more arch than we want. Go ahead and raise up your eyebrow and then relax. We'll do the same thing on the other side. Raise up and then relax. So that addresses this glabellar area. We'll next move on to these forehead creases. we're going to use a fairly low amount of Botox here. In the past, the trend would have been to use a lot of Botox, trying to attack every single wrinkle. But what we've learned over time is that it's much more natural to use smaller amounts of Botox so that you still retain the ability to move your forehead, and most people even retain some of these lines. It tends to look better when done that way, so we'll use a low dose just to soften these wrinkles somewhat. So go ahead and turn towards me. Raise up your eyebrows and then relax. Raise up, relax. And that's it. So that was the whole treatment. As you saw, it took maybe a minute or two. You can see his face. There's just some very slight redness, a little bit of swelling, and that will settle down over the course of the next few minutes or maybe an hour or so. He could go right to work. He could go to the gym, and really no one would know that anything was done. The Botox doesn't kick in right away. It takes about 3 or 4 days to even start to notice something happening, and then it takes about 2 weeks before the final change shows up. I think it's going to look really nice, and what we always tell people the first time that they have Botox or Dysport or Xeomin would be, if there's any concerns, in 2 weeks to come back, and sometimes all we have to do is a minor touch-up to get things perfectly right. And we'll see how this turns out. Sometimes men require higher doses of Botox because the facial muscles tend to be a little bit stronger. We started with a medium dose today, and in the future we can certainly add more, but we like to start conservatively to not overdo it and get a very natural result. And that's about it. Thank you so much for watching. Have a great day.